Every day, you essentially pay your dues by doing the harder thing when it's the right thing to do. Marcy, Dr. Faustin, how are you? I should appropriately say hello.
Dave, I'm doing well. How are you?
I'm good. I am excited to have you here and talk about something I want to say, actually, I didn't tell you this before we recorded, is your lecture was like a smash hit at the symposium on mental health as it is. And so you got the challenging end of the day slot where everyone was already on Zoom fatigue, and they perked up like quite a bit. They were like, oh my God, this is amazing. And lots of people actually followed up and said they bought the entire, not that we weren't all hopefully helpful, but they bought the entire day because they really wanted to hear your lecture. So I think there's a back of the hand hat clap to you for doing such a great lecture.
Wow, thank you. Your words mean so much to me, truly, because the goal is just to get the information out there. And when people are excited about it, then we know change can happen. And that entire symposium was incredible. I listened to a lot of it, even, along with the physical therapy exercises and all the different things that it's just great to learn things and learn it in different manner, really.
Yeah.
And
yeah, so I feel like guilty that I have access to cool people and I just want to pay it forward. Like that's what the podcast is, right? Like I selfishly like to learn more myself and it's a good way to streamline it. But also like, I just have a lot of cool friends who just do interesting stuff in gymnastics. And if we can somehow put that on a podcast or a symposium or make it really cheap for someone to jump on and see, like how in the world would you not want to do that?
What you're doing is amazing. In preparation for the podcast, I listened to a fair amount of yours and you do an incredible job. And I mostly appreciate your vulnerability and your honesty and the way that you can give that safety to those that you're interviewing. And so it shines. So
I appreciate that. I appreciate that a lot. I've got the gift of gab, I guess you would say, as my mom says. But well, I'm sure some of that is going to come out here, right? Because speaking of vulnerability, is we're following up on the symposium because people wanted more information on mental health. And if you look across all of gymnastics, all of sports, if there's something that still unfortunately is stigmatized, not talked about enough, it is for sure like mental health in athletes in particular, right? And I want to preface this really early for a trigger warning is that we're going to talk about some things that are really hard to hear. So if you're someone who has had experience with mental health and it's a tough thing to listen, just please either listen to this with somebody or listen to this with somebody else, maybe like professionally, because I don't want someone to jump into a podcast and not realize what's coming down the pipeline. Is we're going to talk about some mental health stuff. So for sure on that, but can you maybe give a small background on how you got into your role with Team USA and then kind of what then allowed you to obviously be in the situation we'll talk about with Simone and stuff, maybe if you feel comfortable talking about that, but just give people the background of how you got to maybe where you are now so it gives context.
Definitely. Thank you. And I would second that disclaimer. So don't feel bad to stop the podcast or take it in small bits or take it with other people. But we just want everybody to learn and to know that they can get help, most importantly.
Sure.
So I am a family medicine and sports medicine physician. I work at the University of California, Davis in Sacramento. I have a family medicine, sports medicine clinic. I am the associate team physician for our UC Davis Division I athletes. So I share that role and we cover about 700 athletes. And then I also take care of the USA Gymnastics women's national team with Dr. Ellen Casey, who is absolutely incredible human being and friend. I have to throw her in there because she's incredible. Yep. And the way I got into my role is initially I had a mentor who told me to start volunteering. And so I did. And so I worked in clinics with those that worked with the USA Gymnastics team and then was volunteering at the different events. And then in 2019, they asked Dr. Ellen Casey and myself to be the head team physicians, the co-team physicians. And so that's how I am right now within my role. And so my department and my university supports it. And so that's how we are able to do that with all of the travel and things of that nature.
Sure. Yeah. And then so how did it kind of get wrapped into the aspect of mental health? Was this something that you were really passionate of before, or was it something that as your role evolved, you saw the need for it? Like, how did you kind of come into being so passionate about this?
I think I've always been passionate about mental health, even when I was younger, but I didn't know it was mental health. I'm an empath just by nature, and I'm surrounded by a family. My parents immigrated from Haiti, and it's a very poor country, and love is what they have. And love is what they have exemplified to my sisters and my family and how they live their lives. And I think it's always been important to me. And the time that it really came into play was when I was an intern, actually, working in the clinics for the first time. And you just recognize that mental health was about a third of what we saw in clinic. And whether that was outwardly somebody telling you that, or how it was presenting somatically. Are you having symptoms? Are you having belly pain? Is there something organic happening? But really, it was turning out that the mind and the body, they're connected. And so if the mind is not right, then we cannot have the body be right also. And so that's when it really dawned on me how prevalent this issue is with mental health conditions, mental health disorders. And so I've always just been interested in it. And so in all my clinics that I've worked in my family medicine practice, when you're enjoy doing something, you get those patients and people are happy to refer them to you. And so it's a practice of mine, the portion that I do enjoy. Is it difficult? Absolutely. Is it scary? Absolutely. But is it rewarding? It is, just to be a safe place for people to just come and express themselves to you, and the position we're in as mental health providers and professionals, it is a blessing and it is a privilege for us to hear people's stories.
Sure, absolutely. And I think really the thing that I think resonates well with a lot of mental health conversations is, in my opinion, and please correct me if I'm wrong, I think that the biggest issue with stigmatizing mental health is that people feel as though they're literally the only one on the planet that struggles with the thing that they're dealing with. And I think that is typically the first wall, or to break down a layer of the onion, which is like, one, you're not alone, because literally everything you're probably dealing with, there's multiple people out there, particularly in sports, that deal with what you're going through, right? Whether it's competition anxiety, whether it's, body image issues, whether it's anxiety and depression, whatever else it is. And that first initial, like, oh, wait a minute, there's other people that struggle with this like I do. I think that is really eye-opening for people. And it helps to kind of get to that next step. And talking about podcasts and stuff, it's actually wild. I'm not sure if you know this, but I actually listened to a podcast with Tom Bilyeu with Dr. Burns, who is a psychologist who I think pioneered CBT therapy. And for some reason, whether it was just that was the day or that was the moment, that was finally the podcast for me that I was like, oh my God, there's other people who struggle with this that sound like my story. And oh my God, there's something that can help me. Like therapy can help me. And it kind of, as a man, it's very hard to destigmatize therapy and what that looks like. And I found a therapist that was finally like, okay, I'm going to go to therapy. I'm going to work on it. And I've quickly found out that a lot of the things that I struggled with in my gymnastics career, whether, body image or unrelenting standards of perfection that gymnastics kind of unfortunately comes with, or just a fear of being alone, like a lot of those things manifested in my career, and a lot of it made sense. But it was only because I found a podcast that somebody else had a story like mine that I was like, I'm not alone. Like, from your experience, do you feel as though athletes are still in that I'm the only one who deals with this, I should be tougher, and I shouldn't have to do this, I should gut it out? Or is it like something else that's causing the stigma of mental health to still be a problem?
It's a great question. And I think just to start with the general population, that stigma is there.
Sure.
And then we have athletes who are already put on a pedestal, whether you're an Olympian or whether you play at your high school, right? Or you play at your middle school soccer team, right? You are put on a pedestal to do great and to be perfect and to hit these standards, like you already talked about, that are just not attainable, right? And I think that a lot of the stigma that's there, especially within different populations, like you said, with men or with minoritized population, people of color, people of a sexual minority, or the LGBTQ population, we know that it's even harder to break through there because the stigma is so rampant and the stigma is the border is there, right? And it's hard to break down. But I think it's just what you said. Everyone thinks that they're alone in what they're experiencing. And I think the most important part is to say, no, we're all experiencing this, right? That this is the human condition of up and down emotions. But then there is a point in which maybe we do need extra support and extra help, and it turns into a mental health condition or an illness. But it's no different than if you have high blood pressure or you sprained your ankle. We have to treat that. And just like you're saying, treatment is doing the therapy, doing the medications, seeing the appropriate people, your own self-care. But if you're not even aware that those things exist, then how can you know that there's a solution for what you're experiencing? And that's what's important for people to also know, right? We don't want to talk about what we don't know we can fix. But this is something that is fixable. And we continue to push this narrative so that people can say, I do need help. And then within that athlete population, I think part of it is they don't want to look, quote unquote, weak, right? Because that's the terminology that has been used over and over again. But what we know is vulnerability is strength, honesty is strength. And when you're able to face that yourself, then you're able to move towards assistance and towards getting help and towards moving to the life that you want to live. And I think what's great is these athletes, right? Michael Phelps made a big push. Naomi Osaka, Serena Williams, Simone Biles. We can name multiple athletes that have come out and said, I struggle with this. But that's also okay. I can still do that sport and I can still be successful in my life, but I can also hold this truth that sometimes I have these issues, but it doesn't stop me from doing things. It just tells me I'm human and I need to do what I need to do in order to get help. And those people are inspiring, right? The world, not just athletes, adults, people all around the world, children, to say, it's okay. I don't feel good.
Yeah. And I think the most important starting building block of this conversation is you have to have an environment that normalizes that. That's something that not only everyone deals with, but also that there's ways to help. Right. And I think as a physical therapist, I see it so clearly, which is like, it's in the mental, or sorry, in the physical arena of sports, it's, I rolled my ankle and it hurts and I need help. Okay, well, what do you do? Well, first we want to make sure there's nothing really serious going on. Let's get an x-ray. Let's make sure you didn't break your leg. Let's make sure everything's okay. If that's okay, there's physical therapists, chiropractors, ATs that have exercises to help you rehab your foot and then kind of get you back. And when you're ready, we'll slowly just dose you back to competition. That's such a normal, understood, expected part of athletics. But the moment it becomes, I'm feeling depressed, like I'm feeling depressed, it's like, come on, just like suck it up, like, and not to be frank, but in the male side, it's like, you're being a wuss. You know what I mean? Like, just figure it out, When in reality, it's like, okay, no, this is a normal thing that happens. People get sad, people get depressed, people get anxiety. Let's make sure, one, there's nothing really serious going on here, which would be suicide, right? Suicidal ideations in this thought. Once that's okay, hey, there's someone to help you. There's a sports psychologist, there's a mental, skills coach, there's a psychologist, a pharmacist, whatever, that can help you with exercises or tools to get you better and kind of get you feeling okay and figure out why we're not doing well. And then we slowly get you back into it. Like, the streamline should be the exact same parallel, physical to mental and emotional. But for some reason, it's just like, it's so unparalleled that those things are the same thing.
Yes. And I would add into what you're saying is, just like that ankle, we get the x-ray to make sure there isn't a fracture. Well, if you're not feeling like yourself, maybe you can't name that, but you go and you see your physician because there are other reasons you might be feeling tired. There are other disease processes outside of a mental health illness that's just manifesting in this way that can be causing your symptoms. So there are many different ways that we can triage and determine, why do you feel this way? And then how can we help you? And that's important, that streamlining of knowing that I don't feel good. It's okay to say that. And then let's figure out what it is. And then let's treat it. And I think that has to start earlier and earlier and earlier, right? When we're young and we played sports, we know if we got injured, you tell your parents, you tell your coaches, you go see the doctor. So we have to start that education at such a much younger age, especially within gymnastics where they're specializing so early. Let's normalize it when they're 5, 6, 7 years old, young. And then that way they know as they get older, this is just a part of it. It's no different than anything else. But we know mental health illness is difficult, similar to, say, concussion, right? You just can't see it. It's not tangible. And so it's hard for our minds to grasp what is happening, and for others that are trying to help you, because there isn't this discrete way to say, I'm doing much better. You can see this, versus an ankle. Now I can walk, now I can run, and you can really easily get those points for you. And for the mental health, there are aspects that we can use. There are questionnaires that we use that are validated to really objectively see, how are you doing? We use it all the time, and it reinforces when you're treating patients or athletes that, oh, this is helping, right? But if we just don't give any tangible goals to set for that, it's really hard for people to stay true to their goals and to know that the treatment that they're doing is helping them to get better. It is not quick, but as long as you stick with it, we know that change comes, right? Similar to the ankle. Oh, now I can vault. But 2 weeks ago, I couldn't do that. This is great. And so then you're more motivated to move forward. And so what I find, especially in our college athletes, we use a lot of those questionnaires, the PHQ-9 or the GAD-7. The GAD-7 is for anxiety. The PHQ-9 is for depression. And we use those scores and I show them, here are your numbers. Here's your total. I'll see you back in 3 to 4 weeks or however long it may be. Let's see where that total is. And when it goes down, people are motivated. They're like, oh my goodness, I do feel better. Right. And so then they say, let me stick to this route. And the other important thing they do is they tell the people around them. They
Mm.
tell their circle, they tell their athletes, the coaches watch them get better, the athletes, their teammates watch them get better, their parents watch them get better. And now we can continue to widen the circle of education regarding it.
Yeah. For sure. And I think as we kind of think about maybe building this kind of, pyramid of things to help out, that foundational layer is an environment that allows you to have that conversation. But two is that conversation, which is the openness and the ability, the same way that we want an athlete to say, I don't want you to wait 4 weeks until your ankle's like you're hobbling around. I don't want you to wait until we're barely hanging on by a thread to tell me your Achilles hurts or something like that. I want you to kind of be comfortable. And that's my role as a coach, physician, medical provider, whatever, is to be like, hey, I'm going to listen to your concerns or what you have, and we'll try to find a tool to help you. Right. That's the same approach we want to have with mental health, which is when someone approaches you and says, I have really bad competition anxiety right now, or like, man, I don't feel okay right now. Something is going on. For us to have the humility to say we need to find somebody else to help us, but then also just to listen, just to be like, okay, yeah, this is a normal thing that happens, and tell me more, like what's going on? Like, can I help you with this? Those two things alone, of the environment that normalizes it and the communication channel available, is one of the, like, if someone comes to you and their ankle hurts and you say like, your ankle doesn't hurt, like just get up there and try a couple more, like they're never going to talk to you about an injury again. Like, you've shut down that communication. If you go to someone as a coach, you say like, I'm feeling a little anxious right now, and I don't know how to manage my emotions. Like, you're fine. Just get up there and you have a mental block. Just do a couple more. Like, you're never going to get that person to communicate again. So those two things, in my opinion, please correct me if I'm wrong, I think are the first two layers that are crucial.
I 100% agree with you. I think that people need to feel safe, and that's just not just safe physically, but you need to feel safe emotionally. You need to feel safe mentally. You need to know that you're not going to be made fun of. And maybe that's outwardly with words or externally with words, but body language, we know, is very important, and it's the universal language. And so people feel that in the way that you're responding to them. And we know people will come to us. It is uncomfortable, but you have to also understand yourself and what triggers you and what makes you move or think in whichever direction that is, because of your own childhood and your life experiences, to know how you are going to reflect that back onto that person that's asking you for help. And that's that self-care that we all need to do, and that self-introspection, the self-reflection of making sure that you can keep yourself present for that person and not put on your own issues or your own experiences onto that person, right? And because then they feel like maybe sometimes that they then have to take care of you, or how is this person always going to react in this way, and go into their own personal experience, but they're just trying to be their individual experience within that.
Yeah, you raise a really important point, which is how context specific some of these mental health triggers are, these insecurities, these things that are really fearful. Whereas in your mind as a coach or as a provider, it might be really hard for you to understand why someone is getting triggered or is having an anxiety around a certain thing. When in reality, there's actually really interesting research around the BLA around its context specific fear conditioning that, like, for me, I never really had a ton of competition anxiety, right? Like, it was just like, I step up and I do it. If it doesn't work out, that's a bummer. But in terms of letting my team down or letting other people down, that was crippling for me, right? And so also, like, certain things that would really bug friends of mine, I just couldn't understand. I'm like, how in the world does that bug you? Like, I don't. So I think you have to understand that it's very resonant for people in terms of certain things, right? So like for me, like when I was younger, like body image was a huge problem for me because I wasn't like a naturally shredded kind of guy. But then something else related to competition anxiety didn't even bother me in the least bit. Whereas my best friend didn't care at all about what he could eat, like Cheetos all day long, and he was shredded and he never had an issue. But he stepped up to the national anthem, made him have a panic attack because he knew he was first up on deck, and he almost fell apart because of that. So that empathy and like, okay, I don't understand exactly why, but I can empathize that you're having a problem with that, and I want to try my best to help you, I think is crucial in terms of, again, building these layers, is that context specificity.
Absolutely. And I think about empathy and sympathy like two different things. Sympathy is looking down at somebody and saying, oh, I'm sorry, and I'm feeling sorry for you. Empathy is you sit down with them. You sit down with them and you say, I'm so sorry this is happening to you, but I'm here for you. I may not be able to fix it, and that's not my job to fix it. And that's the other thing for us, right? We always want to try to fix something, but that isn't our job. Our job is to be there to let people know that they're not alone, just like anything we do in life, right? It's always better when you have somebody else typically with you, right? Especially a new experience or something you're unsure of what's going to happen. When you have somebody that's there with you, it's automatically better. And so when people are also struggling, they also just want somebody with them there to know that I'm not alone and I'm validated and I'm seen in what I'm experiencing. And the other thing I want to also go back to is before we even get to, providing that empathy and for people to come and ask for help, we have to remember that most people can't even name the primary emotions: sad, mad, glad, scared, right? The four primary emotions we have. And Brene Brown, who I'm sure you know of, thinks she's amazing.
Wonderful.
But she came out with the book, The Atlas of the Heart, that named 87 emotions. But a lot of us as adults have a hard time naming how we feel. I feel sad right now. I feel scared. I feel shame. I feel embarrassed. I feel happy. And so if we can't name it, then it's hard also to figure out a way to try to mitigate it. But we know they say, name it to tame it. When you are able to put words to it, then it can decrease that the power that it may feel it has within you.
Sure.
And so for kids, if adults can't do it, and we go back to kids and these athletes, it's going to be even harder for them too, especially if they're not taught this again early on in life to come forward. And so if someone comes to you and says, I just don't feel good. I just don't feel right. I can liken it to a concussion again, right? We saw somebody hit their head and then they're like, I don't know. I'm off, right? We don't dismiss it. We don't say, oh, it's fine. You hit your head. You're a little off. We say, oh no, we should definitely look further into this and see what's going on. It's the same thing when we're looking at others' mental health and whether they're having a mental health illness. Is somebody's coming to you and saying, gosh, I just don't feel good, or my belly hurts all the time. I have headaches all the time. I'm always constantly getting injured. You want to look closer into that. And maybe you just have to ask more questions for them because they just can't name it. And if adults have trouble naming it, then kids and teenagers and young adults are definitely also going to have trouble naming it. But that does not mean that it's not real and it needs to be validated.
And to kind of combine these 2 points we're riffing on, which is the naming of it, but then also the making people aware that they're not alone in this thing, is specifically with athletes from your experience, is what are the biggest things that they're struggling with? Because I think the go-to is competition anxiety, which is like in baseball, they call it the yips or something else like that. But in reality, like, are there certain things that you see more commonly that are the root maybe triggers for people, or like the biggest things they struggle with? Or is there a couple categories there?
I think for athletes, they, again, go back to, they're put on a pedestal. So then they feel less inclined to talk about when they're having a more difficult time. Right. And so when it actually comes to manifest, what I find in my experience is it has been going on for a long time. Right. We're not in the prevention stage. We're more in a reaction stage for that.
Right.
Athletes get injured. Right. And so injuries automatically, especially for you as a physical therapist, you see them very regularly. That we know is a risk factor for decreasing their mental health or manifesting into a mental health illness. Whether it's actually diagnosable or not, what we know is that they are going to have struggles with that injury because it takes them out of their sport. Again, they're not allowed to exercise in some cases. And we know evidence-based shows us that exercise decreases the rates of depression and anxiety. We know that those athletes, a lot of their identity is wrapped into the sport. A lot of, especially the gymnasts, right? Especially at the higher level, they're not going to school. They're doing online school pre-pandemic. And so they have little hobbies or other activities that they are doing outside of the gym. And so then it becomes that the gym is their life. But we want to break that away and say, what else are the other things that you can do to distract your mind from the gym so that you know that whether you win or you lose, or whether you go to the gym or you don't go to the gym, that doesn't tell us if you're a good person or a bad person. That doesn't tell us your worth. It just tells us that, okay, you do this other sport, but you also have your family, your friends, your kindness, your personality, and how you can change the world for just being who you are, not from the successes that you may or may not have from gymnastics. And then, like you talked about, competition anxiety, right? It's very stressful to compete. And when you have to compete for your teammates, that is a difficult thing for that. And so I think athletes have many different layers that make it more difficult to seek out and ask for help. And they just may have risk factors that increase the risk of these issues.
Yeah, and I can definitely speak on the rehab side, right? Because we typically, if someone has a surgery in particular, if somebody has like a stress fracture, I just spend a lot of time with them. You know what I mean? Like it's 2 to 3 days per week, and I'm like regularly seeing them, touching base, because that's just how the rehab process goes. But I can say from my experience, I think the biggest ones I see are, one is there's a fear of re-injury, right? There's a particular like bigger like surgeries like ACL tears or hip issues. They're scared that it's going to happen again, you know, and it's extremely painful. It's extremely debilitating. So that's a big one I see. I also see, I think more importantly, what you're talking about is I definitely see like that low level of depression come in because they're removed from their community, and they're removed from one, the thing they love to do typically, but also their teammates and their friends and all of the people around them. And coupled with that sometimes is the injury, you know, they're not allowed to kind of be active in doing what they're doing, whether that's the physiological side or it's just like, that's my identity as someone who works hard and who is really active. And on those two, I think medical providers, rehab providers really have to do their due diligence of creatively continuing to keep the athlete mentality. You know what I mean? Like reframing a little bit of like, we can work on a lot of things here. And like this random example comes up, which is like blood flow restriction training is a very challenging thing to do after like 2 weeks of an ACL or whatever. Is like, some people, I've seen some people come in very sad and very upset who feel like they're just going to sit there and kind of get worked on for 6 months. And then 2 weeks in, they have BFR on and they have their ACL leg propped up on a bike and they're doing like arm and other good leg sprints. And like, oh my God, like I'm sweating. And like, you kind of see them come back to life a little bit because like, I didn't know I could do this. And it's really helpful. So like, creative ways to keep them in their community. Like I try to make a program that gives them as much they can possibly do in the gym safely within their restrictions by talking with physicians and stuff and going back and like, go spend an hour in the gym.
Exactly.
Just go be with them for an hour and do some core stuff, do some upper body stuff, help coach the little ones, like whatever you need to do, like just get dropped off for an hour, then come to PT and get a good sweat on. And like, you know, that is a very different perspective versus I'm just going to lay here for 3 months and get fixed. You know what I mean? It's a completely different approach. And the other one I think with gymnastics in particular, and I'd love to hear your thoughts on this, is I think what happens, particularly in female gymnastics, when they train so much is they get injured and they can't work out. And a lot of fear of body image stuff starts to come in and I can't quite work out and I'm not really getting my training. And they start to get worried that they're falling out of shape and that people are judging them or talking about them. And also, if you have a situation where someone's been maybe their puberty has been repressed a little bit because of how much they're training or some concerns around red S, they hit an injury and like all of that catches up to them and they grow like crazy. Like a lot of women go through young development very fast in a year with an ACL rehab because their body's just catching up to normal growth. And so I see that personally a lot as an issue that like they're really scared that they're going to fall out of shape and those body image insecurities start to come up. So yeah, I'd love to hear your thoughts on that if any of that resonates with you.
Definitely, it does resonate. And you touch on an important point. So just because when someone's coming back from an injury physically, they have to be ready to go back and, you know, they have to be able to protect themselves, right? To make sure that you're not going to re-injure yourself and you're physically ready to do that thing or that sport. But then also we have to ask, which I always ask my athletes is, are you feeling ready to go back mentally? How is your fear? Where are you feeling? Are you ready to go and try that skill or to get back on the field? Or is this something that you feel very fearful of? Because then again, they can't protect themselves because when you're within fear, you don't have your entire cognition working for you, right? And so then how can you protect yourself if you're so focused on, I hope this doesn't happen, I hope this doesn't happen, instead of thinking about all the normal things you should be thinking about during your sport, especially with gymnastics where, you know, it's a dangerous sport. And so we have to fully be intact and be there in order for people to feel comfortable. And if that means, you know, getting them to ask for a spot when you don't normally need a spot, that's okay. Or if you need to go on the pit first and then gain that confidence to move up. But we have to also address their mental health and their state when they're coming back from an injury. So the worst thing you want is for them to get out there, something happens, and we have just reinforced the story that they have told themselves in their head. And it's going to make it harder in the long run for them to come back. And I agree with you regarding the fear of not exercising, the fear of how will my body image change, and the fear of, am I falling behind than my peers, correct? And I take that same approach. Wherever you can keep them within their community, that is what I think is most important. You know, as long as they're not going to go to the gym and then, oh, I'm just going to try this bars really quick or something, you know, and really reiterate to them, this is not the goal, but do your conditioning, do your training, do your rehab at the gym. include yourself. How can you, do you need to start being, part of the coaching staff and helping with small aspects in that regard? Or how can you help in the gym? Or maybe this is also a time that you do more things with your classmates at school, right? Those things that you didn't have the opportunity to do because you're always in the gym. Go learn a new hobby. Go, try to do new things so you can expand your mind and figure out more about yourself and what it is that you like and what it is that you don't like, and what does your self-care look like?
Yeah, absolutely. And the first point I think I really want to maybe double click on here is that it's really important as a coach or as a medical provider, or whoever, is that when they're in the gym, it's not like they're off in the corner doing their own thing. That's the injured corner, right? That is one of the worst things you can do to a young athlete. It's almost like an error of omission, right? Like there are unfortunately some pockets of the sport, and I'm just going to be honest, that I think still unfortunately, like, go over there and be injured, and like when you're done, come back. Like they still have that psychological warfare mentality. It's getting better and people are moving up. But that is like, man, that's abuse straight up. But that's like brutal to have a young kid go through when they're off in the corner by themselves. They feel like they're not in the group. So like, just do your rehab by beam. Like it's literally not that hard, and just talk to somebody, just like be there. But I think for most coaches, it's unconscious. They don't realize that they're worried. Like, I don't want to hurt you. I don't want to have you be on the event. And like, I get that completely. So as coaches, you need to go extend the handshake halfway and talk to a rehab provider or a physician and be like, what can I do? What can I not do? Are they fine to do this? And really work out a plan. But as a medical provider, it's funny because graded exposure is one of the best tools for anxiety, right? But graded exposure, what do you think physical therapy is? It's just graded exposure. It's just slowly progressive, harder. So you can make the argument that biologically we're stressing tissue, we're getting recovery, and we're kind of going through that cycle. But it's also how you have graded exposure mentally against some of the things they're fearful of. I can tell you, every single person I've treated with an ACL tear, the first single leg hop is like, so you have to kind of give them a roadmap of getting that confidence back slowly in the rehab process. Then eventually a really good return to sport program is doing what you said, which is like, we're going to go on tumble track first, and we're going to do X repetitions here. So you can obviously load the tissue in an appropriate way, but also build back your confidence, get the rust out, get your mind set around what you're doing. That's the same kind of exposure mentally as you would have somebody do on a physical exposure program. They're really one and the same.
I agree with you wholeheartedly. And I think that it is a difficult scenario when, people have, and I remember having to do this, you were in the corner of the gym to do your rehab or your conditioning. And I can understand also the coach's side, where I don't want them close to the floor because I don't want, the perception that I'm allowing them to do gymnastics, but that wasn't the permission that was given, and I can empathize with the coach's difficulty with figuring out how to also navigate that situation, because they want to make sure that they're as safe as possible and no one else is taking that perception that they're trying to move this athlete closer because you did let them do their rehab to beam. Maybe the next thing they're going to do is let them on the beam, but that's not the case, and I can understand that. And I just want to also validate that that is real. Yep. But I think that what you said, athletes are goal oriented, period. Right. They are there. They know what they want to accomplish, and they work towards that. Same thing with the rehabilitation. Have your set plan. This is what we're going to do each step. But then let's include the plan of, okay, let me mentally also get ready for, I'm going to start having to do jumps after my ACL. And so maybe I need to talk to the sports psychologist. Maybe I need to talk to the physical therapist, my physician, my parents about this, but include the mental health as part of that graded return to continue the check-ins at those points too. How are you feeling? Where are you at? And it takes a while before people will trust each other, right? And that's human nature, and that's protective of us. But when people continue to ask the same question over and over and over again, then they say, oh, maybe they actually do care. Maybe for each stage of this, I say, okay, I have to check in. How are you feeling about this? What are your fears? What are you excited for? What are the pros and the cons? Mental health is not just negative. Mental health is what we all have. And sometimes it can come into illnesses and disorders, but we want to know what's exciting you and what are your fears simultaneously so that we can put those positive and negative aspects together. And that also helps to normalize it. It is not only a negative aspect. It is another part of who you are and a part that is critical and crucial to your success as an athlete, but more importantly, as a human being and going on into life.
Yeah, I'm very empathetic to the coach's side of this thing, which is, I trust me, working with 12, 13 to 15-year-old girls on a beam rotation, and one's back's kind of sore and they have a rehab thing and someone's coming back from an ankle thing. Like, I always make the joke, it's like herding cats sometimes, right? You're trying to make everything work and it's just challenging. So I get how hard it is, but that's why you have to have communication with the healthcare and rehab providers to be like, okay, this is your plan. You can hang out here. Here's what you need. Okay, you have your plan that's over here. Like, it's important to kind of stay on top of that. And something that I think you said that's really important to really bring to the light here is that building on this pyramid here of like, okay, the environment, communication, like everyone's not alone, you're doing it. The next building block there from a parent, from a physician, from a coach is unconditional support and worth as a human, irregardless of gymnastics, irregardless of sports, irregardless of what you're doing. And I think that trust is built when somebody really truly knows that you are a human who does gymnastics, not the other way around. You're not a gymnast who happens to also be a human. And I think when people really, and sometimes we try to give this to kids, but when you're young, it's hard to absorb, is that, no, I genuinely care about you as a human and I want you to be healthy and happy, gold medals are cool, if that's your goal, right? And I think when somebody really, as a young athlete, absorbs the fact that this person really cares about me unconditionally, whether I hit the routine of my life and I win for the team and it all goes well, or I literally have the worst meet of my life and I bomb, right? Or I feel as though I'm not ready to do this and something else happens. That really is, I think, is the next step here, is that the Olympians that I've talked to, the elites that I talked to, their parents are unconditionally supportive, regardless of what happens in gymnastics. The coaches are the same way. The physicians, the medical team is like the medical providers, for sure. You need to really take a step back and realize that, like, that person's success has nothing to do with your self-esteem. Like, they are doing the thing and you are helping them, right? Parents the same way. And I think when the culture is built around that, it's very, very powerful, and it's easy to tackle some of these mental health things. When the opposite is true and it's conditional based on your performance, that athlete wears that like a vest full of weights, and it's really hard for them to shake that.
Absolutely. And there are no words that are necessary for that athlete to experience that and to know what the pressure is for them. You do not have to say that. They can experience it. They are watching everything that everyone is doing right around them and how people act towards them after a competition that they do well, or after a competition that they don't. And what is the body language? What is the communication? What is the love that they feel? But you're absolutely correct. But it goes back to the self-reflection of those around the athlete, right? We want the athlete to be self-aware. They're great at their gymnastics. They do incredible things in the gym. You know, we know they have the discipline and the strength physically and mentally and emotionally to do gymnastics in itself. And we're teaching them about themselves. But those around them, the coaches, the parents, the medical professionals, or whoever it may be that may be a quote unquote stakeholder within that athlete, they need their own reflection. They need to know what is their reason for being here. And if you notice these trends of, I'm only excited when they do well and I'm not when they don't, then you need to stop and think about yourself and say, why do I feel this way? And how can I adjust this? Just because you feel in a manner, that doesn't mean you have to react on it. Emotions are not bad or good, right? They're there. That does not mean you have to react to them. But when you figure out what it is that makes you move in a certain way, speak in a certain way, feel in a certain way, and make decisions in a certain way, then you can make that adjustment. But again, it comes back to awareness. We can't have change without awareness. Right.
I think one of the most important, maybe constructive tools I can offer people that I had to reflect on myself with this is, whether it's a coach, whether it's a parent, whether it's a medical provider, is how you react when things go well versus things don't go well. And I think one of the biggest tells for me in terms of really being able to not assume, but infer maybe what's going on in someone is, how do they react when somebody has the best routine of their life and they hit and it's the greatest thing ever, versus how do they react when it's a really tough moment of a fall, or there's this big opportunity and it doesn't go the way they want. I think that's a really important tell for yourself, is if you notice as a coach, parent, whoever, that when things go well, you're like over the moon and super excited, but then things don't go well and you're super angry and you're upset. Like, that's a really important thing to kind of like have a pause moment on and be like, wait a minute, what's my relationship with this? Back to that unconditional support. And I think a really good example of this, and we just talked about it in the podcast, was like Miley and Tammy and Seren. Is like, Miley had the routine of her life. It was amazing. She hit great. Seren was like, hey, that's great. Give you a hug. And he was even keel. Next year, unfortunately the worst bar routine. Hit her heels, blew it, didn't go well. Sarin, hey, it's okay. Like we're gonna get through. Like obviously you're sad, you're disappointed, but at the same time, like an athlete who knows you're there for them when all these people are watching and all these people are looking at them, to have you be there and just give them a hug or a high five and say like, hey, it's all right. Like these things happen. Like, goodness, man, that is so powerful for an athlete to have, because a big red flag for me is when someone takes the credit when things go well as a coach, parent, stakeholder, whatever, but then takes no blame and puts all the blame on the athlete when things don't go well. You can't have it both ways. You guys are in a shared partnership towards a common goal. If it goes well, you both take some joint success there. And if it doesn't go well, you both have to audit what didn't go well and ride that out together.
Yes, agreed. And to reiterate, even if you feel that disappointment or that anger inside because the athlete didn't do as well, that is also not wrong, but it's the what you are going to reflect to the athlete. Okay. That is what's most important. While you can work on your inner self, it's what is coming off to the athlete. And I'd also like to say that if you were upset and that athlete felt that, and sometimes we all make mistakes, we're human, right? But the next step is to apologize. And I think it's okay to go to the athlete and say, listen, I feel like you may have experienced me feeling upset with you for not doing well, but that was incorrect. And the reasons were for myself and nothing to do with you, right? And so when you can state that out loud to the athlete or to the parent or to anyone else around you, right, then that is powerful. Because then they take that load off of themselves too. It's not about me, it's about them.
Right. And sometimes it's not no fault of the coach of their own. And I'm empathetic, which is you can be upset about the situation, but not the athlete. But if you don't communicate that, the athlete in that moment of like spiraling is like, oh my God, I let them down and they're so upset with me and they're angry at me. You could just be frustrated with the situation at large. Like, oh God, like that we had it, man. We worked so hard for that. And you're frustrated with the situation or a judge's score or whatever. But the athlete that's a big distortion in CBT is personalization, whereas they wrap that in as like, oh my God, it's my fault. I made my coach mad. And your mind's like, oh my God, I'm not even upset with you in the least bit. It's just I'm bummed for you and for all the hard work that happened, but it's just being misconstrued. So if you don't communicate that, though, that starts to be a little bit of a spiral for the athlete that they let you down on top of already feeling terrible about the situation.
Yes. And I have a friend who's a therapist, and she always says, what is the story you're telling yourself? Right? What is the story that we are all telling ourselves? And if that athlete, if you're upset with something else going on in the gym, that story that athlete may be telling themselves is, oh no, they're upset with me because I didn't do well. Whereas that coach's story, maybe that they're telling themselves is, I'm upset that this happened over here. And they don't even have a recognition of the athlete, being affected by them. And so again, it's just communication, right? And over communicating. I heard a statistic that whenever you're having a conversation, you only hear about, I think it was 15 or 17% of what the other person is saying.
Whoa.
Right. And so even when I have conversations with good friends and there's a disagreement and, I state my side and that person states their side, and then we realize where we just missed each other, right? We still have the same morals, values, ethics, things of that nature, but we just have our own lens that we see life through because of our upbringing, because of our experience in life. And so we are always interpreting through our own lens. And so the only way to really break that down is communication, right? Communication. Whether you're in the gym and the athlete is saying, something's hurting right now and they're not speaking, but the coach might think, oh, they don't want to do gym today, or maybe something's going on, right? And the athlete's like, no, I'm scared that they're going to think that I don't want to do gym, but that's not the case. I'm not feeling good. There's so much that is lost, where if we can just open up dialogue, honest dialogue, again, going back to being in a safe environment where your feelings are validated and appreciated, then so much change can happen. Good change can happen. Growth can happen. And when people can watch this exemplified around them, then they say, oh, I can do that too. Right? Even if you're in the gym and you're a coach and the way you communicate, everyone is always watching, right? Sure. And so when they see you doing that, then you're like, oh, I can do that too. It's working for them, right? And it's okay.
Yeah.
And it's okay to do that.
You brought up a quote that triggered in my mind too, which is a difference between listening and waiting to talk. I think that's really powerful too, which is sometimes a coach is really, really well intentioned and they're like focusing on a beam rotation and somebody comes up to them and says like, I'm scared about this or whatever's going on or that. And you're like, in the moment, you're like, okay, I don't want to not focus on the important safety thing in front of me, but I also want to do this. And in that moment, you have to turn to that person and say, hey, listen, I hear you. And I really understand that this is bothering you. Can you give me like just 2 minutes so I can finish this thing? And then I'll come over and I'll make sure I touch base with you. That's a very different, trust building mechanism than someone when like you don't take your eyes off, you're like, okay, yeah, sure, I'll get you in a second, 1 sec. Like completely different ways of handling that situation. And so you have to be willing to separate those two things. Like, I'm going to listen, I just need a moment to deal with this first. But then you have to be fully present, like your nonverbal body language, like eye contact. I'm actually listening, I'm actually hearing what you're saying. Like, it's amazing what that does for a young athlete who's really in a tough spot.
I agree with you. And for myself, I'm always doing many things at the same time. And so my brain is always thinking about many different things. And so I have to consciously remind myself, because I move so fast that I have to tell myself, slow down and listen. And so even when I'm in clinic, if it's athletes or my general population, I try to reiterate the story back to them. That forces me to make sure I heard what they're saying and to listen. And so I think it's a type of dialogue. I can't recall the name right now, but it's
motivational interviewing.
Motivational interviewing. And there's another term for it. I'm going to look it up for you.
Yeah.
But it's just reiterating what the person said to you.
Sure.
And then making sure that you're understanding what their statement was or what the question was, and then you can answer.
Yeah, absolutely. And sometimes people are like, oh, they're going to get annoyed because I'm just literally repeating back to what you said. Well, it's better to over repeat back than risk not being heard at all.
Exactly. And it's so common that that's not what they were trying to say. Even though you said something, sometimes that wasn't the point you were trying to get across.
Yeah.
And so then when somebody repeats it back to you, you're like, oh, actually, that's not what I was trying to say. What I was trying to say was X, Y, and Z. And it happens so often, but we're just human. And sometimes we don't realize how things are landing on other people.
Yeah. Intent versus impact is a big one I think a lot about, right? Like, what is your intent versus actually how it landed? Like, back to the example of frustrated with the situation at large, is your intent is that I really love you and I really care about you, but like, this is just frustrating. It lands as like, oh my God, this person's really mad at me. And it's like, oh my God, not at all. Like, that wasn't the situation at all. I want to kind of shift over towards maybe some actionable items for each kind of group that is involved in gymnastics. I think that the next layer here and the importance is everybody has to do their part to contribute towards a better future for mental health in sports in general. And I think the best way to do this is maybe just go through like each kind of like, resources for athletes, then like medical or parent or like the fan in particular is like, I think the most important one is the athlete, which is the gymnast themselves. If someone does feel as though, oh my God, this resonates with me, or like this is a teammate I know or friends, like where does a gymnast or an athlete go for just the start of a investigating, this kind of sounds like I'm struggling with this. Like, where do they go to get a little bit of help?
Great question. First and foremost, you go to whoever that adult figure around you who is a safe person, whether that is your parents or your guardian, whoever that may be, your coaches, maybe not your direct coach, a different coach in the gym that you have a relationship with. Maybe it's a teacher, anybody that's around you. The first step is to state it out loud. And sometimes that even might be a teammate. Hey, I'm feeling like this. And then maybe it's encouraging that teammate to say, hey, maybe you should talk to an adult about it so that we can get you help in that manner. You find your safe space for that. And if that adult is not sure which direction to go, then you get them to their parents or their guardian most of the time, right? Not all the time, because all families and all relationships are not perfect, as we know. And so you get them to whoever that athlete says is their safe person. Because then from there, you can say, okay, let me get you to the physician so we can talk about it. Let's figure out what's going on. And then we can create a treatment plan behind that. And so I think first and foremost is to ask for that help and to find that safe space in which you can go and know what's going on. And for that person receiving somebody who's coming in and asking for help, just to reiterate that it is so important to really directly ask people, are you thinking about hurting yourself? Or have you hurt yourself? And are you thinking about killing yourself? If the answer is not an adamant no, I take that as a yes, right? Even if they're like, well, no, I don't think so. No, That's not a no to me. That's a yes to me. And that means we need to further escalate this conversation. And there's a lot of fear that by asking someone these things, we're going to plant this seed in their brain that maybe this is something they want to do. Maybe they do want to hurt themselves in some manner. But evidence has shown us that is not true. They just want somebody to ask them so that they can discuss it and say, like, how can I get help?
Mm. And in this is a tough situation to keep talking about, but it's important, is the natural instinct when somebody is in that dark place and you say, you know, are you thinking about hurting yourself? And they're like, kind of. And you're like, okay, well, I think we need to talk to somebody because this is bad. And they go, you're making a big deal out of it. It's really not that big of a deal. You're blowing this out of proportion. And then all of a sudden the fear compounds. You're like, oh my God, everyone's going to find out. And like, then I'm going to become like talked about. Like, how do you, as a, oh my God, a parent, a coach, like whoever is getting this, how do you respond to that in a tactful way?
First and foremost, validating how they're feeling. I'm sorry that you feel so bad that you want to hurt yourself. I'm sorry that you feel so bad that you don't want to live anymore. You know, but I want you to know that I want you to be around for a long time, and I'm here to support you so that we can decrease you having these thoughts so you can feel better. It's not just decreasing the thoughts, but it's really you to feel better inside. And so I want to keep you safe. That is my goal. And this is confidential. I will not be telling this to anyone else in the gym. I will not be telling this to anyone else that you think you're fearful that would find out. But really, I'm just going to tell the people that are most important, because we're going to get you help, because there is help for you that can make you feel better.
Yeah.
All I want to do is help you feel better.
Yeah. And I think the most powerful thing that I learned with my own journey and hearing from other people is the opposite of happiness is not sadness, it's hopelessness. And I think that's what gets someone into a really dark place, is where, oh my God, I feel awful. This is terrible, comma, it's never going to get better. This is it, man. This is, I'm out of options. There's nowhere to go. Every day is dark. Every day hurts to be alive. That's how someone gets into a really tough situation. And so you hearing them and saying, listen, there is a way to feel better. Like there actually are really meaningful tools, whether they see one of their aspirational heroes and they kind of went through it, or whether you can just kind of like give them a moment, a glimpse of like, listen, I know it seems dark right now, but there is something that can be done to help you. So like, we just need to get you into the right situation. And as someone who's gone through multiple therapists and kind of had some things that didn't work out, or tried a lot that didn't work and it took a while to settle, that can be really frustrating, because like, all right, here we go again. Another, I'm trying not to swear, another person who's, you know, just going to tell me to think differently and tell me to be grateful. And you're like, that sucks. That doesn't help me at all. And you're like, listen, I know, but there's many things out there. There's this large opportunity of many things. We just got to find the right thing. And I think that small little seed of hope is just so important in those moments.
Hopelessness is very powerful. And as coaches in the gym, or parents, or people that are just around others, if you hear people talk like that, like it's never going to get better, waking up is so difficult, or I don't look forward to anything, those statements are very important statements that you need to be paying attention to. And the next step is not to, in a group setting, say, hey, I'm worried about you, so that person feels embarrassed, but to really take them to the side and let them know, I care about you first and foremost. And I heard you say these, and so I just wanted to check in about what's going on. And the first time they might not answer, the second time they may not answer, but you keep asking, because there's going to be a point in which they want to answer, because all humans want is to connect. Right. In the end with that. Right. And, you know, it's September. September is Suicide Awareness Month. And so I think it's powerful that we're speaking about this, because we need to decrease the stigma so that people feel safe to speak and to ask for help. And we know during the pandemic, these rates have increased significantly.
Yes, absolutely. And I think this kind of transitions a little bit into like what parents and parents and coaches can do, because sometimes they're the first facing action of this. And if someone isn't into the, you know, the really dark place of committing, you know, something that might harm themselves, but more so of it just sounds like, ooh, something's tough here. For me, I think that it's really powerful to, sometimes you go to someone, you say like, hey, are you okay? And like in the group setting with all their teammates around and all their people, I'm fine. I'm fine. I'm just having a tough day. I'm stressed. And you just say, all you need to say is like, okay, if you ever need anything, I'm here for you. If you ever need to just get something off your chest or just say something, like, I'm here, no judgment, whatever. And it's crazy Marcia, how many text messages I've gotten at 1 a.m. after practice. And I wake up the next morning and it's just like, listen, I know I said I was fine, but like, I just broke up with my boyfriend or girlfriend, or, school's really rough right now. And like, my parents are just blah, blah. And like, all of a sudden, this is like, just like biblical like text message of just so long, but just getting it out is sometimes the first step to do it. And sometimes it'll be like, okay, well, just like, I'll come to practice 15 minutes early and like, let's just sit down and have a private conversation about what's going on. And it's school and it's stress and it's growing and there's so many options, right? But just literally hearing objectively to just bounce something off somebody and just have it not be stuck in is all that pressure valve really needs to kind of get the next step going. And so I think that's such an important thing to say. It's just like, okay, well, I'm here if you ever want to talk. And like that literally can really make a huge difference. And in some instances that can save someone's life.
It can absolutely save someone's life. And death by suicide is the second leading cause of death in adolescence.
Mind blowing.
This is the population that we're looking at right now, especially within the gymnast. And so we have to be aware the second leading cause of death is by suicide in this age group. And so to be a safe place where people can come to you and express themselves is life-saving.
Yeah.
And when you're the coach or the parent and somebody is saying those words to you, what you always have in your back pocket is you can always go to the hospital and the emergency department. Every emergency department has psychiatrists or social workers or somebody else that can support your mental health to make sure you are safe from yourself. First and foremost, if you're at home and you can't leave, you call 911, you bring them in. In July of this year, they released the number 988, which is the mental health line for those that are experiencing any mental health disorders, any substance abuse, or thoughts of suicide. So there's also lines that you can text in order to get a therapist if you don't feel comfortable talking to somebody, right? Then you can text that and do that, or you can get help through direct online resources. There are many resources around you. You can go through your insurance if you're looking to get a therapist, call your insurance and have them assist. See your physician. You can get referrals in that aspects of whatever direction we need to go. Just know that there is help that you can get, and there are places that you can send people or take people in order to bring them there so that they are safe from themselves.
Right. And not to, I know this is a tough topic to kind of riff on, but it's just so important, which is my understanding. And please correct me if I'm wrong here, is that there's a difference in intention level between someone saying, I've thought about harming myself and no, I have a plan. Like, this is how I'm going to do it, versus the person who just says like, that's crossed my mind. Like, they're someone who is not on like red alert, DEFCON. You need to like, I'm going to pick you up and put you in the car and go to the hospital, versus someone who truly has said, no, this is how I'm going to do it. I'm going to do this. That person is like needs to be taken immediately to someone to be protected from themselves. Am I wrong there, or is that correct?
That is correct. Somebody has a plan, then you do not leave their side. That person is never by themselves. You bring them directly to their hospital, or maybe somebody's already established with a psychiatrist or have other mental health professionals that are assisting with them. You get them in contact with whoever that person is. They are never left alone. There's others that say, oh, sometimes I think about dying, or sometimes I think about killing myself, or have other various ways that they have those thoughts. Maybe that's not the immediate danger right now, this minute. I'm going to leave the rest of the gym so I can take care of this athlete. But they need to have another adult that is always with them, especially if they're young adults, so that you make sure that they're going to get the help that they need.
Yeah, and I can speak from experience, because my friend who has shared this with me knows that, I'm not going to obviously identify anybody, but she had a situation where she was at that level. She was like literally with a plan, ready to do it. And it was the fact that somebody stopped everything and took them to the hospital and gave them. And she tells me now, looking back on it, that she was not the same person. Like, you're so consumed by darkness that is, you're not thinking clearly. You don't have any logic at all. You're purely emotionally. And she's actually started to dissociate from her original state. She doesn't remember anything. She doesn't remember going to the hospital. She doesn't remember any of what they did. That's no meds. She wasn't medicated at all. Before the whole process of such a dark place to actually getting to the ER, to actually staying in the ER for 2 days, to actually getting to the right spot, she remembers nothing of that. And she was not medicated at all. It was truly just dissociation. But she said, looking back, she's like, if I didn't have that person to just literally like hug me and bring me to where I needed to be, she was like, I probably wouldn't have made it, because I would have gone home and I would have started acting on some of these things that I'm thinking about. So that's why it's so important, because in the same way, I just picture it as like my brother was a pretty heavy heroin addict, and he just was not the same person. It wasn't him. He wasn't even on the same world. He completely was consumed by it. And it's just a different person. That same type of thing is happening when someone's in such a dark spot that they're literally not even on the same psychosis level of thinking straight. And you have to be there to help that person protect them from themselves. You know, does that make sense?
Absolutely. And that's what you're doing. You're helping to protect them from themselves. And sometimes people say, I don't need help. I don't need anything. The story may change afterwards, and they're going to fight you. So prepare yourself for that. But that's okay, because in the end, do you want somebody angry from you, or do you want somebody that's safe from themselves? And that's what you're doing as the adult, especially in that situation. Yeah. And that's what you have to do, to keep them safe from themselves. And we know that the statistics show that those that die by suicide, I think it is about 80% were seen by a physician in the last year or 2 years, right? Oh, and 50% already had mental health disorders, and about 17% or so of adolescents have some type of mental health disorder. A lot of the diagnoses come when they're at this age. And so this is a large transitioning age for those athletes. And we just have to have a high suspicion for this. And you just have to be aware, right? Yeah. We can't just close our minds to doing one thing, but really just look for those things that are going on around you.
Yeah. And so I think the next thing here I'd like to do is maybe take one step above that, which is what most people deal with. Is like, obviously that is a very specific and extreme case of mental health kind of coming to fruition as a tough subject. But I think most people are interacting with athletes that are, like you said, anxiety, depression, loneliness, fear of failure. I think body image is a huge one with low self-esteem and or negative core beliefs around how they view themselves. How do parents or coaches or medical providers who are maybe getting not something super serious, but they're just like getting the vibe that like, ooh, there's something that needs to be maybe unpacked here or dealt with. Like, what's the tactful way to help somebody get to someone they need? Or like, how do you even have that conversation? Because you don't want to dismiss it. But a lot of coaches and parents are extremely well-intentioned, but they're just like, like they just freeze. Like, oh my God, I don't really know what to do with this, but I know something needs to be done.
Absolutely. Again, mental health illness and taking care of it is very difficult. I have taken care of lots of patients, and like I told you, I just got off a meeting before this podcast looking at our mental health for our student athletes, and it's hard, right? And so it's even harder for those that don't maybe not know the resources around, or what are they going to do with the answers that they're going to get, whether that's the parents or the coaches or other adults in that person's life. But I think first and foremost, again, letting that athlete know, I just want you to be safe, right? And I want you to feel happy and to be able to live your life how you would like to live your life, and to state what you're seeing. If an athlete comes to you and says, I'm feeling sad, that's a little bit easier. Okay, well then let's make an appointment. Let's see the doctor. Let's go see your primary care physician or your pediatrician, your family medicine, internal medicine, your sports doctor, whoever it may be. Get to a medical professional, because when you do that, they can help you navigate where do you actually need to go in order to get the best help that you need.
Yep.
That's one. And then two, if it's a situation in which you're maybe just noticing a change, you as a physical therapist, you see them a lot more and have a lot of interactions with these athletes versus myself as a physician. But I will notice, just recently I had an athlete, he loves to come in, he's 14, he plays soccer, tell me about the last game, he was amazing, right? It's his favorite. I love it. And then he came in one day and I was like, okay, you're cleared, you're good to go. And he was so sad and looking down and didn't tell me anything about soccer or school. And I just asked him, I said, this is a change from you. Usually you're really excited, what's going on with you? And just to state what you see, right? This is what I'm noticing about you. I'm noticing this change in you, or you don't want to hang out with your friends as much, or you're always saying that you're tired. I'm worried something else may be going on. I'm here to talk. Do you want to talk about anything? And so I think as adults, sometimes we sit ourselves higher than the children, right? Or the young athletes in that manner. But sometimes we have to bring ourselves down to that level, because we, especially as medical professionals, we have a psychological power. What we say, what we do, how we move, they're noticing it. And just by the pure society and the culture of what we do, we have to be aware of that. But parents and coaches also have that power, that psychological power in which you are sitting a little bit higher than where that athlete is. And so as much as you can to take off that armor for them to feel safe with you is really important. And to know that the way that you approach somebody is critical to them feeling like they're able to express themselves to you or not.
Absolutely. And I think I just keep coming back to this idea of unconditional support and unconditional worth, right? Like as a coach, parent, whatever, whoever it is, some of the most impactful moments I've had with people who are going through mental health problems is when we're having a discussion around their injury or going back to gymnastics or not. And at the end of the day, I'm like, you notice that change and you go, hey man, like you good? Like everything all right? And like, oh man, I'm just, I'm really worried about this, or like, I'm just down on this whole thing and situation. And you have to be willing to be like, oh, listen, I know you have really high level goals and you want to do stuff, but nothing in the world is worth your mental health, of sacrificing your mental health. So like, I know you've been told that you can make national team and you can go to the Olympics and blah, blah, but like, if you're not vibing with that and your goals have changed or you're not feeling it anymore, like that's okay, man. Like we care about you as a human being who wants to be happy and healthy. And if that goes well, then you can talk about gymnastics. Then you can talk about this. And I think in my experience, a lot of younger athletes are they're so scared to move on from gymnastics or change their level of competition or whatever, because they're scared that someone's going to get upset with them. They're scared their parents going to get mad at them. Their coach is going to get mad at them or whatever. And once you say like, hey, it's fine. It's okay. Like, you don't need to impress me. You don't need to do this for me. Like, and if they hear like, oh, it's okay to stop doing gymnastics, it's okay to not go back and be this, what everybody wants me to be, that is a massive weight off their shoulders. And again, sometimes in your mind as a fully functioned adult, you're like, of course, this is like a no brainer. Like you don't have to do this, but in their mind, when they're 13 and all they've known their whole life is gymnastics and high level gymnastics and making this team, then making this scholarship, then making this blah, blah, blah. They think that they're on this hamster wheel. They have to do this by this. And as soon as you say like, no, it's fine. Like go do band. That's fine. Okay. No worries. And they're like, like it's just like you see it like complete. So sometimes over communicating that proactively is really important about like, listen, I love you no matter what. And whatever you want to choose to do, we're here to support you. And that's really, really powerful as well.
And as they transition out of the sport that they're doing, or they're coming down a level or whatever it may be, understanding that we know studies have shown us when those that finish collegiate athletics or elite level athletics, there is a period where there's a higher risk of depression or maybe anxiety because you're making this large change for them. And that's a normal emotion that goes with the change that can be happening. And I think to then, after saying it's okay for you to stop, to then say, hey, it might be a difficult change for you, but that doesn't mean you made the wrong decision.
Right.
It just means that you are adjusting to this change in life and your identity is changing. And so that transition can be difficult. Doesn't mean it's wrong. And I'm here to also support you through that aspect of it.
Yeah, for sure. And I think in the narrow bucket of gymnastics is Eva, God bless her. She's my favorite person ever. She's really good at helping the off ramp, really like finding a way to transition a little bit. And she'd be like, hey, it's fine. You don't want to work, but like we could use some preschool coaches. Like you want to come and just help out here? Like come work for me, do an hour per week of managerial stuff. And like, she's so brilliant because when you disconnect somebody from their sport, like the person may have fallen out of love with the sport of gymnastics, but they haven't fallen out of love with the community and with their friends and with the coaches and with the support. So while they maybe are in this gray, murky month of, do I want to do track? Do I want to pick up art? Do I want to do soccer? Giving them the opportunity to just come and hang out. Like, just like come be a part of the team and like come kick it for a couple hours. Like that's cool. Come in once a day per week and just help us do whatever. Like that's really, really powerful for them as well, to have a safety net there to kind of still be a part of the community. And then, like, oh, like I joined the track team or like I did this, like that's really, really, they can still be involved in gymnastics, whether it's coaching or judging or volunteering or whatever. And they can still get the community aspect they love, but they can remove themselves and move on to a different part of the non-sport stuff, which I think that's a really, really powerful thing for them to have still.
Which is a lot of what happens with physicians, right? They retire, or they work till they're much older, or they retire, but they're still teaching, or they do a clinic here and there. These transitions happen in a lot of aspects of life. And I think we forget to also apply it to athletics.
Yeah, absolutely. The last thing I'd be remiss to talk about is I really want to definitely highlight the role that a fan plays or a consumer of gymnastics, gymnastic sports, whatever. I think that with social media, with everything, and I don't want to dig into the Simone situation, but clearly that was an evident amplification of the moment something goes wrong. Everyone from everywhere is an instant expert in gymnastics and everybody knows everything about what's going on. And that is one of the most challenging things I think for me to see is when you and I and others, I see a human being who needs my help and I don't care how good they are at gymnastics and I work with these people. But when they're in the limelight on a podium and for the Olympics, everyone all of a sudden has got an opinion, and everyone all of a sudden, like, obviously the athlete has to not look at comment sections, but I think there's a responsibility as of a fan or a consumer who's got quick thumbs on Twitter to check what they're doing before it goes on. Cause I don't think they realize the, again, intent versus impact on a 280 character tweet. You may think it's benign and a joke and it's fun, but then that gets consumed on the other side and it's a massive trigger for a death spiral, right? And I really think that people as fans and consumers need to understand their role and their responsibility on the athlete's mental health. Not, they don't have to fix it, but they should caution what they tweet. That's what I'm trying to get at.
Yes, Simone is, I'm so proud of her, and for the way that she is destigmatizing mental health illness within the world and for all ages. And her vulnerability is incredibly courageous. And I think it continues to inspire everybody, including myself.
Yep.
You're right. We live in a world of social media time. And I didn't grow up in it. I did not do college athletics with having it. And so the pressures that they now face on top of just the normal sport, but now with social media and digital media and television is incredibly immense. And, for me, it feels a bit unfair for them, truly. And I was able to, with a couple of other mentors of mine, we wrote an article about the effect of media on the mental health of elite athletes in the British Journal of Sports Medicine, because I think there can be a negative effect, but it can also be positive. But what you're talking about with the fans and the consumers is people want to hear uplifting words, just like we're talking about in the gym, right? People want to know their worth and to know that they're good enough. And so those words are really helpful. But what's not helpful is when people can sit behind the screen and have an opinion and tell you how to do things and bring people down. We just need kindness in the world, and know that your words matter. And even if someone is your teammate in the gym or somebody is an Olympic champion, they may see your comments. And so just remember that they see those and they are human. Athletes are human, and we forget their struggles to get to where they are, and the very small percentage of success that you get to see of them. You have not seen any of their journey or any of their past. And so we just have to have more empathy as a world, really, and more kindness, and be aware that words have impact.
Yeah. I think that's a great way to end too, is I remember vividly when that was happening. And obviously I'm at the clinic with a bunch of people, and we treat a ton of professional baseball players, and everyone's in there. And of course it's like everyone's talking about it. And I think really it was just a moment of a lack of empathy and a lack of understanding. And I think the message I hope to send to fans, even if you are in gymnastics, is maybe realize that you don't have all the data points. You don't really have multiple perspectives on what's going on. And there's not a single person on the planet Earth besides arguably you and Simone, maybe, that really knew what was going on. And even that, only Simone knows what's going on. And I think when I came into the clinic and people were like, quick to throw stones in a glass house, so to speak. And I was like, okay, but do you understand what the twisties are? Do you understand, that a high risk of injury can occur here? And when I actually broke things down for them, and I'm like, you ever been lost in a wave at the beach? Let's go that times 1,000. And then possibly that you could break your leg. And they're like, oh yeah, that makes a lot of sense. I definitely understand. And I was like, see, here we go. Right. And someone who I think was the night before, who was vehemently upset because he was like, I can't believe this. Right. And I explained, I'm like, oh, okay, I understand. So maybe it's not so much that you're entitled to have your opinion. You're allowed to do whatever. However, maybe gather as much information and realize you don't understand the full context of the situation before you tweet something up, before you post something, before you get real hot on Twitter, because you can delete your comment, but it still gets seen,
It still gets seen. And just like you don't want to be misunderstood, right? If someone says, oh, it seemed like you were acting in this manner, and then you actually communicate what the entire story was of my day, then they say, oh, that makes sense. I understand what you're saying. Nobody wants to feel misunderstood or feel like somebody else is putting their perception on them. Well, if you don't want to, then no one else does. And just because they're athletes that are at the highest level that are on television, that does not mean that you have the right to also put in your opinions, because they are human and they feel what you feel, and you don't want to feel that negative feeling or feel that shame or embarrassment or feel like somebody else is talking negatively about you. So then they also do not want to. Yeah. Right. They're human, just like all the rest of us. And I think we just have to remember that, and it'll help you teach you to be kind to other people that are around you in your own world.
Yeah.
right? The goal is to better understand each other, right? Diversity in people, diversity in thought. This is how we grow.
Yeah.
Grow as individuals, grow as a group, a community, a gym, the world, right? But until we're able to stop accusing and instead try to learn, are we able to actually make some of that change?
Mm.
And so just to remember, treat others as you want others to treat you.
Yes, I think that's a great way to end. Marcy, I thank you so much for what I think is going to be a very impactful and positive podcast. Definitely one of the more, I like them all, but definitely one of the more, I guess, resonant ones that I've had with someone. And so I just appreciate all the work you've done and, your resolve through some tough situations to come on and share and stuff like that.
Thank you so much for having me. And I appreciate your willingness to break down these stigmas by having me on this podcast. So thank you.
My pleasure. We'll see you soon. Okay.
Okay. Sounds good.